The spotlight has been on prostate cancer this week following former Prime Minister David Cameron's announcement that he's been treated for it. The disease kills around 12,000 men in the UK every year. The National Screening Committee will announce tomorrow whether screening should be introduced. Earlier I spoke to Professor Imran Ahmed and he explained how prostate cancer is currently detected.
The best way is for the GP to do a PSA test, and that has age-specific cut-offs, and if it's elevated then patients will get referred in for an MRI, and the MRI is actually very accurate in picking up clinically significant prostate cancer or not, and based on the MRI the patient will be counselled whether to have a biopsy or not, and that biopsy will then reveal definitively whether the patient's got prostate cancer or not.
Because we talk so often about prostate cancer, people wonder, why is there not a screening programme for prostate cancer?
The simple answer is that the PSA test isn't that great, and that a lot of things can cause it to go up. So PSA is prostate-specific antigen, so it's specific to the prostate but not cancer. So benign enlargement, infection can cause the PSA to go up, and we see a proportion of men with prostate cancer that have normal PSAs. So if that's going to be your triage test to determine whether the patient has an MRI, it's not that great, which is why it's not been adopted as a screening tool as yet.
So this new trial that we've been talking about, the £42 million that's being spent, is that about trying to find a better way then?
Yeah, so we know MRI is very good, so one of the arms of the trial is just to offer that group of men an upfront MRI. There's newer tests such as the spit test where men will spit into a tube and will detect whether they're genetically at higher risk of prostate cancer, and that will then triage them to an MRI. So it's ways of maybe adding to the PSA or replacing the PSA blood test to screen men, and that's what the trial's trying to answer, better ways to kind of determine who to screen and to screen smarter.
Does it come down to family history or genetic factors, lifestyle factors? Who really is at risk?
So important thing is men over 50. If there's any worry, any doubt, go and see your GP, get a blood test. Men who have got family history, we know 10 to 20% of prostate cancer run in families, so they should definitely get checked out. And we know Afro-Caribbean men are double the risk of getting prostate cancer and more aggressive, so they're the men that we want to kind of screen as well.
The National Screening Committee is expected to make a decision tomorrow as to whether to recommend that the NHS rolls out a national screening programme. Do you think that that's a decision that they're likely to take and go ahead with, or do you think that they'll say it's not necessary?
It's 50-50 because the last time they met 5 years ago, the evidence hasn't really changed that much, and the trial you're talking about is only just open, so it's not going to report for 3 years. So a lot of the evidence they'll be using to screen is based on the same evidence they had 5 years ago when they decided not to screen. What's changed is it's very much more in the public eye. There's a lot of famous people, including politicians, that have been diagnosed, and that's great, it's raising the awareness, but has it actually changed the evidence that using PSA to screen is appropriate now when it wasn't 5 years ago? I'm not sure it has.
What are the symptoms then? What should people be looking out for?
So the first thing to say is most of the time prostate cancer doesn't have any symptoms. Symptoms that men do have, such as poor flow, struggling to get started to pee, going more often during the day, at night, they're often a sign of an enlarged prostate. And even for those men having those symptoms, I would recommend going to see the GP, because then there are things we can do about it, and the GP can assess you to make sure there's not any cancer in the background.
We'll be keeping an eye, obviously, on the decision from the National Screening Committee expected tomorrow, and of course what comes out of this huge trial that's taking place as well. Thank you so much, Dr. Imran Ahmed, for joining us on the programme.
Well, thank you.